Welcome to Logical Ayurveda. Today we are going to talk about Varanadi Kashayam as an yoga in detail. Varanadi Kashaya as it is called in the south, and Varunadi Kashaya as it is called in North India. It's a very important Ayurveda medicine, and it holds utmost importance in treating Santarbhajanya Vyadhis like hypothyroidism, PCOD, hypercholesteremia, and fat and water accumulation in the body. It is very useful in treating this, and it is very, very important and relevant in 21st century. And knowing about this yoga will definitely help us to better treat patients and give very good results in Ayurveda medicine. But before knowing any effects of medicine, it is very important to know the adverse effects of medicine. Before knowing the benefit that a medicine has to cause to the patient, you definitely have to know about the adverse effects that the patient medicine can give to a particular patient. So before prescribing Varanadi Kashayam, I need to remember 4 points in the mind, and ask 4 questionnaire to the patient, and after you are satisfied with the questions, then only you have to give Varanadi Kashaya to a particular patient. Number 1, you need to ask about whether you are an active patient of gastritis and whether you are taking any medicine for gastritis regularly. Do you have burning sensation in stomach now or in the past? You have to ask that, number 1. Number 2 is fissure. Are you the patient of fissure in ano? Do you have either in the past or now, did you had bleeding during defecation or burning sensation during defecation, all the symptoms of fissure? Did you had that do you have that actively, or did you have had the fissure in the past? Number 3 is urinary tract infection. Do you have burning sensation in urination and all the stuff now or in the past? Or if the patient is a female, then you have to ask, are you suffering from excessive white discharge? All these 4, gastritis, fissure in ano, urinary tract infection, leukorrhea, all these 4 are linked to definitely some form of pitta. And if you are going to prescribe Varanadi Kashayam to that particular, if the answer of the patient is yes, and if you are going to prescribe Varanadi Kashayam to the patient having gastritis, fissure in ano, white discharge and urinary tract infection, definitely you have to think twice, and you have to proceed with caution if at all you have to prescribe Varanadi Kashayam. And I will tell you what medicine can be better instead of Varanadi Kashayam for pitta, prakriti and vikriti patients. So if the patient has all these 4 symptoms, gastritis, fissure, white discharge, UTA, definitely you have to rethink about giving Varanadi Kashayam, or you have to be careful in such cases. So what is Varanadi Kashaya? Where we intend to use Varanadi Kashaya in the patients, in which condition it is useful? Varanadi Kashayam is explained in Ashtanga Hridaya Sutrasthana Varanadi Gana. So Varanadi Gana, what does Varanadi Kashaya contain? It contains Varana, Sahachara, Chitraka, Shatavari, Bilva, Brahati, Dvikaranja and Darba. So predominantly in practice we see the Varanadi Kashayam is Ushna because it contains Varana, Chitraka, Sahachara, Karanja, Bilva, etc. All these medicines. So what are the effects of these medicines? It is Kafahara. It is Medohara. Definitely treats hypercholesteremia. Definitely reduces obesity. It helps in reducing the weight of the patient. And it treats Mantagni. It improves the digestive fire, and it helps in digestion. And it is also useful in Urustamba. The Falashruti of Varanadi Kashayam is Urustamba. Urustamba can be equated to a condition where meralgia parasitica. There is a condition called meralgia parasitica where the patient suffers numbness in thigh along with the burning sensation in the outer part of thigh. That is because if the patient have excess obesity, lot of fat gets deposited in thigh, and it puts pressure on femoral nerve, which causes numbing sensation around the particular area. That is called meralgia parasitica. It happens because of obesity, and Varanadi Kashayam is excellent in treating such conditions. So it is also useful in Shirashula. Now, Shirashula here does not mean Pittaja migraine. Shirashula here means Kafaja migraine, Kafaja Shirashula, where sinusitis. All the kapha is blocked because of excessive Shita Virya Dravya intake of the patient, or Kafavata Vriddhi. The patient has sinusitis, and the patient has blocked kapha in all the channels of sinus, and the patient has heaviness, and the patient has heaviness of the head, headache, etc. In sinus headache, it is Varanadi Kashayam along with Kanchanaragukul is very effective. You should not prescribe Varanadi in Pitta Shirashula. And Gulma and Vidriti. All these conditions, especially it is Kafahara, Medahara, Mandagnihara, Urustambahara, Shirashula, Kafaja Shirashulahara, Gulma and Vidratihara. So this medicine is excellent in treating such conditions. Now, before discussing Varanadi in detail and the disease where we are going to give Varanadi Kashayam, I really want you to convey two stories that happened in real time of Varanadi Kashayam, one with a good outcome and one with a bad outcome. And these stories will make you understand how to use and where to use Varanadi better. Now, patient number one, a lady, came with hypothyroidism, puffed face, increased weight, delayed menstrual period, etc. And she was having a TSH elevated. Now I am treating that particular patient and her HB is low, etc. So I am treating that particular patient. I gave Varanadi Kashayam plus Punarnavadi Kashayam, Kanchanara Guglu Chandraprabha, Lohasvam Abhyarashtam and Haritaki Churna for Anulomana. Now this patient was getting her Kafavataja Pandu or Staulya getting treated. Now something happened within 2 months which was miraculous. This patient was also having secondary infertility. She had her first baby before 8 years, and she has been trying to get conceived ever since, and she was not able to get conceived. She tried all sort of treatments to get a PCOD treatment and PCOD treated, and nothing was ever working. The beauty that happened is within 2 months of giving the particular medicine, she got conceived. And I had to stop the medicine abruptly because it contained medicines like Abhyarashtam, Haritaki Churnam, etc. Anulomana Dravyas cannot be given once a patient got conceived. And the moral of the story and the take back to home is that it is such a beautiful medicine. It gives unintended side benefits to the patient. Once that Kapha is getting treated, once the Meda and Staulya getting treated, the patient is getting all kind of benefits. And I also want to treat, I had a bad experience with the Varanadi Kashayam. Once when I was treating the patient, I had to give for Medohara Kashaya for the patient, and so it shows Varanadi Kashayam, Kanchanara Guglu. Little did I know and little did I investigate that the patient had white discharge before, and without understanding this, I gave this, and the patient's white discharge has increased so much that it took another 15 days and I changed the medicine to coolant in nature, Shita Veera Dravyas, etc. And I had to treat the patient for 15 days to get a white discharge reduced, which was just increased with 2 days of administration of Varanadi Kashayam. So improper administration, not selecting a proper patient, etc. Can always lead to patient having stomatitis, patient having ulcer, patient having increased fissure, patient having increased burning sensation during urination, and then the white discharge, increased leukorrhea, etc. So this is the problem while giving Varanadi. You have to be very, very careful in giving Varanadi to Pitta Prakriti and Vikriti patients, and in Grishma Rutu and very hot climate, etc. It is better to avoid Varanadi Kashayam. To understand the indications of Varanadi Kashayam better, we should only keep in mind about two things. Wherever there is growth in the body and wherever there is obstruction in the body, one should use Varanadi Kashayam, provided the patient is fit for it. How do you decide whether the patient is fit for it? The 4 golden questions that you need to ask before prescribing Varanadi Kashayam that I mentioned in the earlier video. The 4 golden questions, that is gastritis, whether the patient has gastritis, whether the patient has fissure or bleeding, whether the patient has repeated UTI, or the patient has white discharge. You should be very careful in prescribing Varanadi, or it is better to not to prescribe Varanadi depending upon the condition and the patient involved. So wherever there is growth and wherever there is obstruction, definitely Varanadi Kashaya should be prescribed. And when I mean growth and obstruction, what kind of growth and obstruction? First, growth. Wherever there is growth, you prescribe Varanadi Kashayam. The good example of growth is nasal polyp. In nasal polyp, you can prescribe Varanadi Kashayam and Kanchanara Guglu to reduce the size of the polyp. And in excessive fat accumulation, obesity, hypercholesteremia, etc., definitely fatty liver, accumulation of fat in the liver, in all this condition, wherever there is fat growth, definitely you can prescribe Varanadi Kashayam and Kanchanara Guglu, provided the tick list is good. And another type of growth is polycystic ovarian disease. In polycystic ovarian disease also, as I told, Varanadi Kashayam along with Kanchanara Guglu is very beautiful in treating polycystic ovarian disease. Sometimes I mix Varanadi with Saptasaram, sometimes I use Saptasaram Kashayam alone when the periods are irregular, and I also make sure whenever for this growth, wherever possible, I also include Shivaguliga, because that is also useful in treating the PCOD and other conditions, other growth conditions as well. Wherever there is polyp or some mass inside, definitely Shivaguliga also will help along with Varanadi Kashayam and Kanchanara Guglu. So even in hypothyroidism, Now, whether in hypothyroidism or goiter, swollen thyroid glands, whether all patients we can give Varanadi? No, definitely all patients we cannot give Varanadi. Wherever there is kapha vata involved, wherever there is medo dhatu involved, definitely we can go for Varanadi. And you should also keep in mind the climate of the desha where you are giving. You cannot go on prescribing Varanadi Kashayam along with the Kanchanara Guglu for 6 months in Chennai or Rajasthan based climate, because it definitely at some point of time pitta is going to get aggravated. So you should always see desha kala and dosha dusha and accordingly treat the patient. So in hypothyroidism definitely Varanadi is good, but when pitta is involved it's better to go for Punarnavadi and Gokshara Guglu or Punarnava Guglu etc. But if kapha vata is involved, definitely Varanadi Kashayam Kanchanara Guglu I find it very useful. And in fibroadenoma of the breast, definitely you can use Varanadi. So wherever there is growth in the body, you can use Varanadi provided the patient does not have pitta symptoms. Or even if the patient has pitta symptoms, you can prescribe the medicine or adjust the medicine in such a way that Varanadi does not give any bad effect to that body. How to adjust the medicine, I will tell that particular thing in the last part of this video. And wherever there is obstruction, wherever there is normal flow of dosha dhatu, wherever there is normal physiological flow, something that is obstructing that physiological flow, you can definitely prescribe Varanadi Kashayam. Good example of Varanadi Kashayam is gallbladder stones. I make sure I treat gallbladder stone less than 0.8 centimeter, 0.8 centimeter, 18 millimeter, and there are no multiple stones, there are no excessive sludge, then only I prescribe medicine for gallbladder stone. If the stone is more than 1 centimeter, I don't touch the stone. If the stone is stones are multiple and the patient has severe symptoms of cholelithiasis, fever, an active symptom, etc., I prescribe surgery. Wherever the patient stone is less than 8 mm, and then only I go with different kashayas like Varanadi Kashayam, Patola Katro Inedi Kashayam, Vilvadi Gulika, Kanchanara Guglu, etc. Such kind of medicines I give it to the patients, and I have found good results out of it. I have had my successes and I have also had my failures as well. So it's not a steadfast rule that somebody comes with 0.8 centimeter of gallstone, you're going to give Varanadi Kashayam, definitely you're not going to have results. And it depends on a lot of other factors as well, that we will discuss in some other video. And kidney stones, wherever there is kaphaja ashmari involved, wherever the stone is rock solid, definitely ashmari is a kaphaja roga. Ashmari happens because you eat a lot of meat or a lot of oil fried foods and you don't move a sedentary lifestyle, you don't drink enough of water to flush out the flush out excess of protein or fat you have taken, then only kidney stone happens, kaphaja ashmari. In that kaphaja ashmari, provided there is no pitta symptoms, provided there is no burning sensation, urination or blood in urine, etc., can definitely use Varanadi Kashayam and Kanchanara Guglu to break that stone and get it out in shorter time. You can also use Pashana Bedi along with it, Hajrul Yahud Basma, etc. These all things are useful along with Varanadi Kashayam. And sinusitis, as I mentioned in the last video, the sinus is something that is obstructing the normal flow of phlegm. So sinusitis happens, the patient have obstruction of nose, heaviness in the head, etc. In that particular stuff where there is kapha involved, Varanadi excellently relieves the kapha and gives the clarity, clearness to the channels, and help in removing the phlegm that is present in the sinus. So there in Kaphaja Shirashula, it is definitely very much helpful in Varanadi Kashayam and Kanchanara Guglu. The crux of the matter is wherever there is growth and obstruction involved, definitely you can go for Varanadi Kashayam provided there are no pitta symptoms in the patient. So how to manage even with the patients having pitta symptoms, then also you can manage by giving Varanadi Kashayam. For example, what is the maximum that Varanadi is going to do? Varanadi is basically Ushna Ruksha. It can cause constipation. So whenever you prescribe Varanadi Kashayam, you can co-prescribe, if you have doubt that the patient is going to get constipation, you can co-prescribe Brihat Triphala Churnam, Trivrat Lehyam, Anuloma Churnam, etc. And that particular problem is solved. And when the patient is having burning sensation or gastritis, etc., I make sure I do not prescribe Varanadi. Or you can mix it with Varanadi Kashayam plus Bala Gulichadi Kashayam, or Varanadi plus Gulichadi, or Varanadi Kashayam along with Acidact or some Ulcerex tablet or some anti-ulcer tablet you can give along with it. That can neutralize it, but if the patient is extreme pitta and have active burning sensation, make sure you don't prescribe Varanadi Kashaya at all. So if the patient has UTI, you can co-prescribe Varanadi Kashayam with Punarnavadi Kashayam, with Kamaduga along with Mukta, and with Narikela Asava, etc. Something which can reduce the pitta, you can prescribe along with it. So constipation, burning sensation and urinary tract infection, you can find the proper medicine for that, and you can co-prescribe. If at all, you have to definitely use Varanadi Kashayam and Kanchanara Guglu.